Having an effect on 2% of men and 3.5% of females, binge eating disorder was added to the DSM-5 after many people were diagnosed with an eating disorder that did not fit the criteria of existing ones. Binge eating disorder is defined by a person consuming large amounts of food in a small period of time with lack of physical control over themselves. People with the disorder have episodes where they eat when not hungry until uncomfortably full and then feel sad or depressed afterwards. Episodes can be triggered by surroundings or emotions, like having a low self-esteem or someone commenting on body figure. Episodes can also be random, like on the way to work or in the middle of the night. These inconveniences can add up and turn into something more serious, like losing a job after constant lates or an irregular sleep schedule. More often than not, binge eaters tend to hide their binges because of the guilt and shame of having no control of themselves, which just makes them feel even worse to be in the situation. Although there are no specific causes to binge eating disorder, there are many factors. One would be social pressure from the media and peers to look a certain way, and how family members comment on how your body should look. Another possible cause to binge eating disorder would be psychological factors. Many cases of people with binge eating disorder had or have depression, have self-esteem issues, and or are socially isolated and dissatisfied with their body. Biological factors that contribute to causing binge eating disorder would be having a family history of eating disorders, lack of serotonin, and malfunction of the hypothalamus, which is part of the brain that controls hunger and fullness. Treatment for binge eating disorder varies from multiple therapies and medicine. The first therapy is cognitive behavior therapy. This therapy helps you with negative feelings and getting more control over your behaviors. The second therapy is interpersonal psychotherapy. This therapy strengthens relationships with family and friends and helps stop triggered episodes from feeling left out and socially isolated. The third therapy is dialectical behavior therapy. This therapy helps to cope with stress and helps regulate emotions. Although therapy is a great treatment, it takes time. Some people just need a faster fix. This is where medications come into play. Vyvanse, Topamax, and antidepressants are all treatments for binge eating disorder. If not treated, binge eating disorder can leave physical and psychological side effects. Psychological side effects include stress, insomnia, depression, anxiety, and low self-esteem. Physical side effects include obesity, joint problems, heart problems, type 2 diabetes, and sleep apnea. Without treatment, the effects only get worse and worse. This is because of a cycle that the effects make. The more depressed and stressed the person is, the more prone they are to binge episodes. The more binge episodes they have, the more unhealthy they get, which causes them to feel depressed and stressed about their health, and then the cycle continues. This concludes my presentation. I hope you learned something.